Are there alternatives to eyelid surgery for a 29-year-old female? I'm a 29-year-old Asian American female, and unfortunately, I carry a genetic trait of one double eyelid and one monolid. I would like to have upper eyelid surgery to fix my odd-looking left eyelid in hopes of creating more symmetry. My concern is that I'm still a bit young, and I wonder if this would cause marked difficulty for a future surgeon if I were to repeat this procedure 30 plus years from now. Are there non-invasive options I could look into?
Thank you for your question. You've submitted a question with two photos, and you're looking for an alternative to eyelid surgery. And you state in your question that you're 29 years old and that you have essential asymmetry, where one eyelid crease is more well defined than the other. You refer to the one side as a monolid, or just a difference between the two eyes. And you are concerned that if you have surgery now, that you will potentially make it difficult for a surgeon in the future, let's say 30 plus years from now, if you were to have the surgery again. Well, I can certainly share with you my perspective on this type of situation, which I deal with a lot in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is a significant part of my practice. In fact, patients come to me from around the world for both primary or first time having surgery, as well as for revision surgery for undesirable outcomes. So when I looked at your photos, the one thing that you didn't clarify in your question, but I think is fair for me to assume, is that in the second photo, where you appear to have more symmetry, that you used some kind of a tape to try to create that lid appearance. And this is a very popular strategy that a lot of people of Asian backgrounds have used to try to create a double fold. Well, certainly that helps you understand and differentiate the type of procedures that can be useful, and also ultimately meet this concern about doing something minimally invasive. So let's understand something. First of all, eyelid surgery, or Asian eyelid surgery, is typically divided into two types: incisional versus non-incisional. And although there's certainly a lot of debate about what is the best way to approach or create double folds, in my mind, the incisional approach has a specific indication. And what do I mean? Well, whether we do the non-incisional or the incisional approach, we're creating a connection between the skin and the muscle that lifts the eyelid, called levator muscle. The way I make this distinction is, the questions I have are: is there too much skin? Is there excess fat? Those are the two main questions. And of course also, is there drooping of the eyelid or ptosis? But basically, if there isn't any of those conditions, then I would suggest you consider this procedure called a non-incisional Asian eyelid surgery. So what does that mean? Basically, with the non-incisional procedure, you are technically making openings, which are technically incisions, but they are little points along the projected crease, or the intended crease, that allow access for the placement of stitches. And these stitches connect the skin to the levator muscle. Now, when it comes to the level of invasiveness, this is as minimally invasive as you can get, because there is no removal of skin, there's generally no removal of fat, and you're essentially placing stitches that can create the same type of crease or comparable crease as you have with the eyelid tape. So as far as the concern about a future operation, you have to understand that you deal with an issue, or at least my philosophy is, you deal with the issue when it bothers you. And although you feel like you're young at 29, certainly you're not too young to have this type of procedure. As far as the concern about a future doctor doing another procedure, well, I think that either operation, whether it's incisional or non-incisional, a future doctor is going to do what needs to be done based on your anatomy at the time. And to help you understand that, think about 30 years from now, there are going to be changes related to facial aging. There's going to be changes in bone structure, bone mass, volume in terms of the skin, soft tissue, and fat around the eyes. So although, yes, it is a technically somewhat of a challenge, different from a primary surgery, generally speaking, you treat the anatomy for what it is at the time. And so I don't think you necessarily have to be overly concerned about what the future surgeon would need. But really, if this is something that's bothering you now, I think the option of doing a non-incisional procedure pretty much meets the criteria. Essentially, underlying anatomy is not really significantly altered by a non-incisional procedure. Sometimes I refer to it like quilting. You're placing a stitch in a way that connects the skin, but really there's nothing else that's changed. And so I think that that's something that's worth considering as you further investigate your options. So I hope that was helpful. I wish you the best of luck. And thank you for your question.